All right, so today we're getting right into the nitty-gritty of the human heart. Buckle up.
That's right, diving deep into the world of cardiovascular pathologies.
Love it. And it looks like we've got some juicy material to work with thanks to a Dr. Clarkson, who I'm assuming is like a heart whisperer.
Let's just say they know their stuff.
Perfect. So one thing that jumped out at me was this whole thing about heart murmurs. I always thought those were a one-way ticket to Panic Town, but apparently they're pretty common.
What's the deal with those extra sounds? Is my heart just, like, humming along to its own beat?
Well, not exactly humming, more like a bit of turbulence in the flow. Think of it like this. You ever hear that whooshing sound when water flows through a narrow pipe?
Yeah, totally. It's the same principle with heart murmurs. When blood flow within the heart encounters a narrowed valve or a leak, it creates that whooshing sound that we hear as a murmur.
Ah, so it's like a plumbing issue, but in my heart. Not ideal.
Not ideal, but not always a five-alarm fire either. It all depends on what's causing the murmur and how severe it is.
Right, makes sense. And Dr. Clarkson mentions different types of murmurs. Stenosis and regurgitation were two that caught my eye. They sound kind of intense.
Well, they describe different ways that heart valves can malfunction. Stenosis is like a door that's sticking. It doesn't open all the way, so blood has to squeeze through a smaller space. That's often what causes the whoosh sound.
Okay, I'm picturing that. What about regurgitation?
Regurgitation is more like a leaky faucet. The valve doesn't close properly, so blood flows backward. Neither one is great, obviously.
Definitely not. So how do doctors figure out what kind of murmur it is and what's causing it?
It's like a puzzle, really. By listening carefully to the timing and location of the murmur within the heartbeat cycle, we can get a pretty good idea of which valve is acting up.
Wow, so it's like a whole secret language our bodies are speaking through these murmurs? Incredible.
The human body is full of surprises.
Speaking of surprises, this next one's a doozy Takotsubo cardiomyopathy, also known as broken heart syndrome. Okay, drama alert. What is this condition and what makes it so fascinating?
It's as dramatic as it sounds. Imagine experiencing a sudden, intense emotional stressor, like the loss of a loved one, or even extreme joy, believe it or not.
Seriously, joy can break your heart.
It's rare, but yes. In some cases, this extreme emotional stress can trigger symptoms that mimic a heart attack, chest pain, shortness of breath, the whole 9 yards.
But wouldn't a heart attack show blocked arteries or something?
That's the thing with Takotsubo cardiomyopathy. The arteries are often clear. Instead, what happens is the left ventricle, the heart's main pumping chamber, temporarily changes shape.
Wait, what? It changes shape, like morphs into something else.
It's kind of like that. It typically balloons out at the bottom, which
Yeah.
affects its ability to pump blood effectively.
Hold on. Are you saying that emotional stress can actually change the shape of my heart? Because, wow, that's both incredible and terrifying at the same time.
It's a powerful example of the mind-body connection, and it highlights how important managing stress is for our overall health.
Understatement of the century. Okay, I'm definitely adding avoid heartbreak to my to-do list. But seriously, this is wild. So we've talked about heart murmurs and broken hearts, but Dr. Clarkson also dives into blood vessels and a condition called vasculitis. In his analogy, fire in the plumbing.
Ouch. Yeah, not the most pleasant image, but it definitely gets the point across. Vasculitis is essentially inflammation of the blood vessels, those crucial pathways that carry blood throughout the body.
Okay, so we don't want any fires in those pathways. What makes vasculitis so dangerous?
It's tricky because vasculitis can affect blood vessels of all sizes, from tiny capillaries to major arteries. And depending on where the inflammation is happening, the symptoms can be all over the map.
Ah, so it's not a one-size-fits-all kind of condition. Makes sense given how widespread our blood vessels are.
You got it. And to make things even more interesting, there are different types of vasculitis, each with its own set of challenges. Dr. Clarkson mentions giant cell arteritis, also known as temporal arteritis. This one tends to target arteries in the temples.
Okay, and what happens? Giant headache.
Headaches are common, yes, but it can also cause jaw pain and even vision problems.
Vision problems. Now that's scary.
It can happen if the inflammation affects the arteries that supply blood to the eyes, and if it's not treated quickly, it can lead to permanent vision loss.
Okay, I'm adding be nice to my blood vessels right next to avoid heartbreak on my to-do list. Early detection is key here, right?
Absolutely. The sooner you catch and treat vasculitis, the better the outcome.
Got it. So, inflammation, bad news, no matter where it rears its ugly head. Now, Dr. Clarkson also talks about shock, which sounds equally terrifying, but in a totally different way. What is shock exactly, and why is it so dangerous?
Well, think of it this way. Your circulatory system is like a well-oiled machine, right?
Uh-huh.
Blood needs to be delivered to all your organs and tissues efficiently for them to function. Shock throws a wrench in that system.
So it's like a sudden breakdown of the delivery service.
You could say that. Essentially, shock occurs when your body isn't getting enough blood flow to meet its needs. And it can happen for a whole bunch of reasons. Severe blood loss, a heart attack, a severe allergic reaction, you name it.
Okay, so lots of potential culprits, but all roads lead to this dangerous lack of blood flow.
Exactly. And that lack of blood flow sets off a cascade of problems. Your organs start to suffer because they're not getting the oxygen and nutrients they need.
So it's not just a sudden drop in blood pressure, but the domino effect that follows.
You got it. Initially, your body tries to compensate by doing things like increasing heart rate and constricting blood vessels. This is what we call compensated shock. But if the underlying problem isn't fixed, things can quickly spiral into decompensated shock, which is much more serious.
Decompensated shock, that sounds ominous.
It is. That's when the body's attempts to compensate start to backfire and things get really bad really fast.
Okay, officially adding avoid shock at all costs to my ever-growing to-do list.
Exactly. It's like hitting the gas when the engine's about to die. It just makes things worse in the long run.
Yikes. Talk about a vicious cycle. So yeah, definitely avoiding shock at all cost. This deep dive is really driving home how interconnected everything is in our bodies. Like, one minute we're talking about murmurs, the next minute it's shock.
And that's just the tip of the iceberg. Our cardiovascular system is incredibly complex, which is why it's so important to understand how it all works and what can go wrong.
For real. This conversation is making me want to invest in a good stethoscope stat. But, it also makes me think about my friend who recently mentioned a heart murmur they found at her checkup. She was totally freaking out, but the doctor didn't seem too worried.
It's understandable to be concerned, but like we talked about earlier, not all murmurs are created equal. Some are completely harmless, especially in younger, healthy individuals.
So it's like anything else, get it checked out, but don't jump to the worst case scenario right away.
Exactly. Knowledge is power, my friend. The more we understand about our bodies, the better equipped we are to advocate for our own health.
Couldn't agree more. Okay, let's shift gears a bit and dive into another fascinating topic from Dr. Clarkson's lecture aneurysms. And he mentions something called a berry aneurysm, which I gotta say sounds kind of cute for something that can be so dangerous.
Right. You'd think it was a new breakfast cereal or something. But yeah, aneurysms are no joke. Imagine a weak spot in a tire. As you keep filling it with air, it starts to bulge outwards. That's essentially what an aneurysm is, a weakening and bulging in the wall of a blood vessel. And just like with that tire, if the pressure gets too high, it can rupture, which can be life-threatening.
Okay, so that analogy really paints a picture. And
Yeah.
the berry part, does that have to do with its shape or something?
You got it. Berry aneurysms are small, rounded bulges that usually form at the base of the brain. And often, they don't cause any symptoms until they rupture, which is why they can be so dangerous.
Oh, wow. So it's like the silent threat lurking in your brain. Not cool.
Yeah.
Dr. Clarkson also talked about abdominal aortic aneurysms, or AAAs. Are those the ones that people worry about with their aorta?
Those are the ones. The aorta is the major artery that carries blood from your heart to the rest of your body. So yeah, an aneurysm there is a big deal. If it ruptures, it can cause massive internal bleeding.
Okay, now I'm really starting to feel my blood pressure rising. This is all so fascinating, but man, it really highlights how important it is to be aware of our own bodies and any potential red flags.
Absolutely. Being proactive about our health is key. Know your family history, talk to your doctor, and don't ignore any unusual symptoms.
Words to live by. Speaking of red flags, Dr. Clarkson also touched on rheumatic fever, which, if I'm remembering correctly, is connected to strep throat.
You got it. It's actually a rare but serious inflammatory disease that can develop as a complication of untreated or undertreated strep throat, specifically the kind caused by group A Streptococcus bacteria.
So not just any old sore throat can lead to this, huh?
Yeah.
What makes this particular strep so nasty?
It's all about the immune system. Sometimes when our bodies fight off the strep infection, the antibodies we produce get a little confused and start attacking our own tissues, particularly in the heart, joints, skin, and even the brain.
Whoa, wait a minute. Our own immune systems are attacking us? That's kind of terrifying. So what kind of damage are we talking about here?
The heart is the main concern with rheumatic fever. It can cause inflammation of the heart muscle, the lining of the heart, or the sac surrounding the heart, all of which can weaken the heart, damage the heart valves, and lead to long-term problems.
Okay, that's some serious stuff. So the takeaway here is don't mess around with strep throat.
Exactly. Get it treated quickly and properly to prevent any complications.
On it. Now, speaking of heart inflammation, I also noticed pericarditis in Dr. Clarkson's lecture notes. Sounds painful. How can you tell if it's pericarditis or something like a heart attack?
That's a really important question because the symptoms can be very similar, especially the chest pain. But there are some key differences. The pain of pericarditis tends to be sharp and stabbing, and it often gets worse when you lie down or take a deep breath. It can also radiate to the neck, shoulder, or back. With a heart attack, the pain is usually described as crushing or squeezing, and it might radiate to the left arm or jaw.
So, different types of pain, different locations. I got it. But either way, chest pain is never something to ignore.
Never. Yeah. If you're ever having chest pain, especially if it's new or unusual, get yourself to a doctor, ASAP.
Agreed. Okay, one more condition from Dr. Clarkson's lecture that caught my eye, infective endocarditis. The name alone sounds like something out of a medical thriller.
It does, doesn't it? But unfortunately, it's a very real and potentially life-threatening condition. It happens when bacteria or other germs enter the bloodstream and infect the inner lining of the heart, particularly the heart valves.
So, we're talking about an actual infection inside the heart. How does that even happen?
You might be surprised. Bacteria can enter the bloodstream through things as simple as a dental procedure, a cut or infection in the skin, or even IV drug use.
Wait, seriously? A trip to the dentist could lead to a heart infection.
It's not common, but it's definitely a possibility, especially for people who already have heart conditions like damaged or artificial heart valves.
So, another reason to take good care of those pearly whites. Okay, but back to infective endocarditis. What happens once those pesky bacteria make it into the heart?
They can cause inflammation, damage the heart valves, and even form clumps of bacteria and other debris called vegetations, which can then break off and travel to other parts of the body, causing even more problems.
This is like a horror movie playing out in my head.
Thankfully, infective endocarditis is relatively rare, and if it's caught early, it can usually be treated successfully with antibiotics. But it definitely highlights the importance of preventative measures, like practicing good hygiene and talking to your doctor about any risks before medical or dental procedures.
Okay, noted. Now, before we move on from this fascinating but slightly terrifying exploration of all things cardiovascular, I want to circle back to something we touched on earlier, Berger's disease. I feel like that one deserves another look because of the whole smoking connection and those scary potential consequences.
You're right to be concerned. Berger's disease, or thromboangiitis obliterans, is a rare inflammatory disease that affects the small and medium-sized blood vessels in the arms and legs. And like you said, it has a very strong association with smoking. We're talking almost all cases occurring in current or former smokers.
Wow, so this isn't just about lung damage anymore. Smoking can actually trigger this inflammatory response in blood vessels far from the lungs. That's right, smoking isn't just a risk factor for lung cancer, it can impact your entire vascular system.
Absolutely. Chemicals in cigarette smoke can damage the lining of blood vessels, triggering inflammation and increasing the risk of blood clots, which can lead to pain, tissue damage, and in severe cases, gangrene.
Gangrene, that's a scary thought. Dr. Clarkson's notes didn't hold back on the details, which is a powerful reminder that our choices have very real consequences.
It's definitely a serious condition. But the good news is that quitting smoking can significantly slow down the progression of Berger's disease and reduce the risk of complications.
It's never too late to make a change that could save your life. Okay, let's switch gears from the scary stuff and talk about something that affects a lot of people. Peripheral vascular disease, or PVD. It sounds like something that could affect anyone, not just folks with pre-existing heart conditions. What exactly is PVD, and should we be worried about it?
You're right. PVD is more common than many people realize, and it often goes undetected until it becomes a significant issue. Essentially, PVD is an umbrella term for any condition that affects the blood vessels outside of the heart and brain, most commonly those in the legs and feet.
So those aches and pains in my legs after a long day, could that be PVD?
It's possible, but don't jump to conclusions just yet. While pain, especially when walking, can be a symptom of PVD, can also be caused by many other things. The most common type of PVD is peripheral artery disease, or PAD. This happens when plaque builds up in the arteries that supply blood to your limbs, narrowing them and reducing blood flow.
Ah, so it's like atherosclerosis, but in our legs instead of our heart.
Precisely. And just like with atherosclerosis in the coronary arteries, PAD increases the risk of blood clots, which can completely block the artery and lead to severe complications like tissue death and even amputation.
That sounds incredibly serious. So besides leg pain, what are some other warning signs that might signal PVD?
Keep an eye out for things like cramping in your legs, or hips that starts during physical activity and goes away with rest, numbness or weakness in your legs or feet, coldness in your feet, sores on your toes, feet, or legs that don't heal well, and a change in the color of your legs.
Okay, I'll definitely be on the lookout for those. This deep dive has been full of cautionary tales, but also incredibly empowering. It's like Dr. Clarkson is giving us a crash course in understanding our cardiovascular system. But before we wrap up, I have one final question based on Dr. Clarkson's lecture, Thrombophlebitis. It seems to be all about blood clots, but what makes it different from the other conditions we've discussed?
Thrombophlebitis is when a blood clot develops in a vein that's already inflamed or injured. It's like adding insult to injury, literally.
Ouch. So we're talking about a double whammy of inflammation and clotting. Where does this typically occur in the body?
The most common location is in the legs, specifically the deep veins, which is why you often hear it referred to as deep vein thrombosis, or DVT.
DVT, that's the one you hear about happening to people on long flights, right?
Exactly. Prolonged immobility, like sitting on a long flight or being bedridden, is a major risk factor for DVT. It's not just about the immobility itself, but the pressure that prolonged sitting puts on the veins in your legs.
So get up and move around, folks. Now, we've talked a lot about blood clots today, and they seem to be the villains in so many of these cardiovascular conditions. What are the warning signs of a DVT, and what should someone do if they suspect they might have one?
The warning signs of a DVT can be subtle, but it's essential to be aware of them. Watch out for swelling in the affected leg, pain or tenderness that's often described as a turley horse or cramp, warmth and redness in the area, and even visible enlarged veins.
So if you notice any of those signs, especially after surgery or a long period of immobility, don't hesitate to seek medical attention right away.
You got it. When it comes to blood clots, early detection and treatment are critical.
This deep dive into cardiovascular pathologies has been an eye-opening journey. We've covered heart murmurs, broken heart syndrome, aneurysms, inflammatory conditions, blood clots, and so much more. It's amazing how interconnected everything is within our circulatory system, like a finely tuned orchestra with the heart, blood vessels, and blood working in harmony.
That's a great way to put it. It's easy to take our cardiovascular health for granted, but today's deep dive highlights just how crucial it is to prioritize a heart-healthy lifestyle.
Absolutely. You've given us a lot to think about and maybe a few things to add to our health checklist. But seriously, this knowledge is empowering. It's like Dr. Clarkson has given us a roadmap, not to scare us, but to help us make informed decisions about our health.
That's what we're here for, to empower you with knowledge and encourage you to be proactive about your health.
Well said. This deep dive has given me a newfound appreciation for the incredible work our hearts and blood vessels do every second of every day. We've covered a lot of ground today, but this is just the tip of the iceberg. It makes you wonder, beyond the usual advice like diet and exercise, what else can we do to really fortify our cardiovascular health? What are some unexpected ways to support this incredible system? That's something to ponder. Until next time, stay curious.